felt in every one of those places where these people lived for a long time and lived with vitality, they had purpose in their life. So, we're going to be doing a colonoscopy, and do you have any questions about that?
Joining us now is our Chief Health Editor, Dr. Partha Nandi. Our Chief Health Editor, Dr. Partha Nandi.
Nandi is here now.
Do you feel the burn? No, not that burn.
Oh, not that burn? Oh.
That awful feeling right here with your acid reflux. Hello, good to have you with us.
I'm feeling the burn.
Yes, you are.
You need to make sure you avoid nicotine altogether and then limit alcohol consumption as well.
Sounds like you're taking some fun away, but I
think
also
I'm taking all
realize
your fun away.
Pretty much ruined my life.
He's out. For us who treat this disease, it is actually an epidemic, so really be careful with your diet. And if you have these symptoms and it's persistent, see your doctor to get treated.
In America, there's a buffet.
Yeah.
Right? And it's me against the buffet.
Yeah.
I remember, even as a young kid, that little boys, little girls would come to my door and beg for food. And that vision never left me.
The Bula Bula diet, the Shula Shula diet, the flower eating diet, look at the sky and then drink water diet, none of that is sustainable, right? Because what if it's a cloudy day? What do I do? The way I view television is that you're talking to one person at a time, and I do that every day with my patients. So I felt that if I could have the same integrity, the same passion, the same honesty that I have in the office, I can extend that to the television set, both with the studio audience and the audience at home. I want to take that and extend it to Detroit, to the nation and the world. I live and practice in Detroit, and I believe our city and the people that live here represent the best of America. I wanted to create a place that folks can go to that not only delivers health information, but also helps us share inspirational stories to help all of us grow, with real problems discussed in depth with real solutions. You are the most important person to the patient. This is Ask Dr. Nandi. We talk about how the mind and the body are connected.
You have to practice relaxation. It doesn't come naturally to us.
Very difficult. To sit in silence for a minute is one thing, but for more than a few minutes, if you're not a practitioner of that, is one of the most difficult things I've ever done. Any topic that can affect our health and our well-being, we're going to cover. Superbugs are strains of bacteria that are resistant to antibiotics. We're talking about being transgender. We're going to be exploring organic foods, teen drug abuse, talking about express workouts, depression. We try to cover that entire topic within an hour.
Ryan has a chronic autoimmune disorder. We discovered he had cataracts in both of his eyes from
And that's on the steroids.
From the prednisolone,
Yeah.
That's right. There's about a 90% chance that he's now sterile because of the Cytoxin treatment.
Oh.
So we had seen a lot of success treating other autoimmune conditions with medical marijuana. This has made a world of difference.
We talk about your experience and then have an expert come in. Are there any real dangers in medical marijuana?
It could be beneficial for some people, but yet the abuse of it is far more.
And then explain exactly what is happening.
Cannabis is really not a drug, it's a botanical medicine.
But so is cocaine.
Well, the one difference.
The problem is, and I'm sorry to interrupt, but people make that argument to me all the time. It's a plant or it's this. So is cocaine, so is digitalis. And then have the studio audience ask questions that are important to them.
If I have a friend who I know for sure has a drug addiction, what should I do first?
It's a very difficult situation to be in. The most important thing is that you understand that you're about to save someone's life.
My passion is to empower people and change their lives. I nearly died of rheumatic fever when I was 6 years of age. I'll never forget the doctor who saved my life. I remember his name even, Dr. Chandrasekhar. He showed me compassion, strength, and knowledge. These are traits that a 6-year-old boy really needed at that time. Now today, I'm healthy with no permanent effects on my heart, thanks to my first health heroes, Dr. Chandrasekhar and my parents. My life's course was set. I too wanted to be this kind of hero. What a privilege, right? To care for folks when they're ill, vulnerable, and afraid. To give them back their health and life, that would be my charge. The next revolution is really not about the next phone that you have that you can snap on, or the next computer that's going to run the world. The next revolution is going to be about humanity. we always end our show with a saying. It's a beautiful word in the Hindi language that literally means the light in me honors the light in you, and that word is namaste. So namaste to each and every one of you. Thank you for watching. See you next time.